Hello ladies and gents, and welcome to another Active Hearts video with myself, Andrew Rix. So in today's video we're going to be looking at knee pain, and this is really primarily coming from like knee pain that I've had in the past during, say, my marathon running, etc. By no means is this video like giving any medical advice, and it's not a video obviously to treat the area. So if you do suffer from knee pain, please get maybe checked by your doctor before even considering doing this video. As I said, these exercises that I'm going to go through are really exercises that I've found that to work by strengthening up my patella, my kneecap, whilst doing maybe these running exercises in the past. All you need for this really is a suitable, stable chair with 4 legs. I've got a mat on the floor, so if you use maybe the carpet, that can obviously be help, just a bit of added comfort. And I've also got a step, so if you don't have one of these portable steps, please use maybe like a stair, or you could use maybe a step, or you could make a step out of something sturdy. Wear comfortable clothing, like I'm wearing here, comfortable pair of shoes, just loose clothing. Keep well hydrated as well, so have some water on standby to help out. There are roughly about 7 exercises. And these are exercises, as I said, that I used to do when I found I had a bit of knee pain. And they are all very gentle, low impact exercises. There's no compression on the joints. It is very kind of soft movements, helping to mobilise and strengthen the muscles in and around the knee joint. So the first one, what we're going to look at is a standing hamstring curl. So I'm out of the chair. I'm just going to place the chair around so you can see that. So I've got a nice sort of stable base at the back just here, just for balance, so I can hold on to that. So with the injured knee, or the pain in the knee, so let's say for example on my left knee just here, what I'd be doing is holding the chair, thinking about the posture, tummy is in, and then we're just actually the hamstring flexion here and extension, whilst I'm just bringing the heel up towards my bottom. We'll do this for just 10 repetitions. So that's 3, 4, it's a slow movement, 5, 6, 7, that's good, 8, 9, and one more, 10, and just relax, okay? So we're not doing loads of repetitions because the pain could be, quite bad. It's just some gentle movements to, one, help to kind of get a bit more elasticity in the hamstrings. It improves the flexion of the joint and trying to increase the range of motion as well. Strengthening up those hamstrings is important for everyday life, whether it may be walking, and by having some stronger hamstrings and obviously glutes as well, you're going to help to just take the pressure off of the patellas, your kneecaps. The next exercise, what we're going to do is calf raises. So calves, this part of the leg. So what we're going to do, holding onto the chair, and what we'll do is we'll do it with both feet, just to kind of be in sync. So we're coming up onto our tiptoes and then slowly back down again. Okay. Again, by another 10 repetitions, and by strengthening up these calf muscles, that's going to help with everyday things like walking as well, taking the stress off of your patellas, etc. So 3, 4, think about the posture, nice and slow. 5, 6, 7, 8, 9, and one more, 10. Okay, so you should feel that starting to work in that calf muscle, getting a bit more blood flow into that, and getting that nice and warm as well. So that's another very good exercise for kind of strengthening up in and around your knee area, but by having stronger hamstrings and calves, it's just going to give that knee a little bit more comfort with walking, less pain. So the next one, slightly a little bit more challenging, okay, and you do need a chair. We're doing box squats. So with box squats, what we're doing basically is we're going to adopt a squat position. So I'm going to be in front of the chair like so. My feet, now this is important as well, are shoulder width apart, and my toes are pointing slightly outwards in line with my knees, as you can see that. Okay, so that's the natural gait for this position. And I'm going to have my hands just out in front of me, keeping the posture nice and up, tummy's pulled in. I'm going to go down into a squat position, and when I feel the chair on my bottom, I'm going to go back up again. So it's just slightly tapping it with my bum. So it looks like this, the exercise. I'm ever so gently just going down, and I feel the chair, and then I'm back up again to the top. If you find that you're going too deep in the squats and it's causing a bit of discomfort in the knee, then don't go as low. Okay, so I'll just do a side profile so you can see that. But the most important thing, as I mentioned at the beginning, is the technique and the posture with this. Keep your head up, okay, toes pointing outwards, slightly outwards, and tummy's pulled in, shoulders retracted, and we're going down into a squat position, just touching the chair, and then back up again. Okay, so 10 repetitions, and remember, you don't have to go that low. If it causes any pain whatsoever, I would advise avoid the exercise completely. Okay, so this is primarily targeting the glutes, so the buttocks, strengthening up those quadriceps as well, and that in effect will take all the pressure off of these kneecaps as well. So 10 repetitions, nice and slow, controlled, breathe through it, head up, here we go. 1, 2, 3, keep breathing. 4, 5, 6, 7, well done. 8, 9, last one. Okay, well done. Good job everyone, excellent stuff. So that is a really good exercise for strengthening up basically all lower limbs, using a lot of core strength as well, but primarily building up those quadriceps and those glutes to take those pressure off those patellas or those kneecaps. Okay, good. So next one, let's do some step ups. So I'm going to just move the chair out of the way. So this is where you do need a chair or like a raised step, sorry, not a chair, a step or a raised platform, so you can step up onto it. So with my left knee, which is the injured knee, or where I get the pain, what I'm going to do is I'm going to just put a step, place my left foot onto the step, and I'm going to step up. It's a very slow and controlled movement, so stepping up, and then I'm just going to step back down again. Okay, so that's what we're doing. So what we're doing is we're actually loading the left knee as we're stepping up, because it's taking all of the body weight up into that joint. So 10 repetitions, nice and slow. We're strengthening up these quadriceps again, glutes and hamstrings, and we're stepping up like so and back down again. Okay, 10 repetitions, take your time. Okay then, here we go. Nice and slow. 1, 2, 3, 4, 5, that's good. So just watch where you're stepping, keep breathing through it. 6, 7, 8, almost there. 9, last one, nice and easy, and 10. Good job, well done, just relax that. Okay, so remember, you have got the beauty to pause this video. If you want to have a little break, grab a drink, then please feel free. So moving on to the next exercise, we are doing some lateral leg raises to really try and target the inner and outer thighs, so the adductors and abductors. We need our chair again, like so. And we're going to be holding the back of the chair. Think about the posture. So I'm going to be using my left leg again, and what I'm going to be doing is lifting the leg up laterally, just to the side, and then back down again to that stable base. It's nice, slow, controlled movement. You're going to feel it all basically in the outer thigh, but by strengthening that will help to strengthen all the ligaments in and around that joint as well in the knee. So 10 repetitions. Here we go again. Nice and easy. Breathe through it. And 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Okay, good job, and relax. Well done. So the next one, let's do some, bring the chair back in, we'll do some seated hip flexion. So with the chair, back in again, think about just the posture. So shoulders back, tummies in, heads up, nice, deep, relaxed breaths. What we're going to do, just walk forwards with your hips to the final third of the chair. In this position, we're going to do these exercises which are basically hip flexion, just to allow a bit of flexion at those hips. We'll just do 10 repetitions, and I'm going to be doing it on my left leg, as that's where I get the pain, on the left knee. Hands just either on your thighs or just by your sides, but again maintain the posture. So what we're going to be doing is from the hip, we're lifting the knee up to the ceiling or towards the chest area, and then back down again to the floor. Okay, 10 repetitions, keeping it nice and easy. Here we go, and 1, 2, 3, 4, good, 5, halfway, keep that posture, 6, 7, 8, almost there, 9, and 10, just relax. Good, excellent, well done. So that is that one done. The last exercise, so we're already on our 7th exercise. So I only chose 7 of these exercises because I thought they were probably the best ones that I personally felt from when I was, had this knee pain back in the day. So this one, we don't need the step, we don't need the chair, but we do need the mat or a comfortable surface, maybe a carpet, etc. So if I move these bits out of the way, the exercise is called a pelvic breech. So what we're going to do is gently lower yourself onto the mat, and we're going to relax the back onto the mat, and we're going to eventually relax the head down as well. Hands just down by our sides. As you can see, my knees are flexed and my feet, soles are flat on the floor. We're going to do give you a quick demonstration. So a pelvic breech is we're going to push our hips up towards the ceiling. So it looks like this, pushing up. Hold it for maybe 2 seconds, and then slowly bringing the bottom back down to the floor again. Okay, so we're going to do 10 repetitions with this one. A really good one, obviously, for strengthening up those glutes and as well as those quads and hamstrings. But it works a bit of your core stability as well. All these muscle groups are all incorporated, going to help you when you're outside walking, cycling, etc. Okay. So here we go, 10 repetitions, and pelvis up and down. 1, up and down. 2, keep breathing through it, don't hold your breath. 3, 4, 5, halfway, keep going, keep breathing. 6, 7, 8, 2 more, 9, and last one, ladies and gents, and back down again. Good. And then just slowly to one side, and then just use your arms just to push yourself back up. Fantastic. Well done, everyone. So just 7 very sort of simplified exercises. You don't need much equipment, just a stable chair and a step and a comfortable surface when you're laying down, a mat or carpet. But as I said, these exercises are primarily really to try and strengthen up the muscles in and around the knee area where you get this localized pain. As I say, it might not be perfect for everyone. This isn't a complete cure. This isn't giving you medical advice. This is just exercises that I've found in the past to help myself, and hopefully you may be able to benefit from this as well. If you find that you're still getting the pain, I would say avoid doing these exercises, and obviously speak to your doctor as well. But yeah, it's worth at least just trying, giving it a go, and see what you think. If you've got any questions or comments, please feel free to leave those in the comments box on this page as well, on the channel. Okay, but well done everyone, good job, and I'll see you in the next video.